Hi, I'm Dr. Steve West, and I'm here today with my colleagues Dr. Kelly Gary and Dr. Carolyn Graham, and we're going to be talking to you about one of the key research deliverables of Project Empowerment. We're going to be giving you the overview and results from one of the aspects of our national survey that we've conducted as part of our NIDER grant, and it is on the topic of research capacity of disability and rehabilitation faculty. This is one of the key deliverables that NIDER requested when we were funded with this grant, and it's one of the ways we are tapping into the need for rehabilitation research, development, and capacity building in our target audiences. The other two being consumers and active rehabilitation professionals who are providing services in the field. Research capacity is the ability of individuals and institutions to develop skills and resources that provide for the competence to conduct and do research. Basically, research capacity is just that, what you need to be able to do research and get it done in a quality manner. There are several aspects of research capacity. Some are individually based and some are institutionally based. We're going to be talking about a little bit of both. When Dr. Graham gets up, she's going to talk about the methods that we've utilized in this research project, which basically involves surveying active faculty members in disability and rehabilitation settings. But we're also going to talk about the institutional characteristics. We queried them both on their skills and abilities and what they need, and their institution's core services and what they may need. But for faculty, the elements of rehabilitation research capacity involve the ability to define a research problem. That sounds easy, but it's not the most intuitive thing for those of us who are maybe new or novice to the area of research. It's the ability to design and conduct research studies. It's one thing to be able to sit in a class and learn about research activities and be able to pass an exam on it. It's another thing to independently design, implement, conduct, and conclude a research project. It's the ability to publish and disseminate results. Publishing is a very competitive business. Getting your message out to the right shareholders and key holders of a particular area is not something necessarily intuitive, and if you don't have the proper guidance or supports, it can be a very difficult task. It's the it is the ability to evaluate the quality of research and the existing research literature. Just because something published doesn't mean it's great. You have to be able to discern what is quality about research, what the shortcomings are of published research, and indeed of your own research and your own research products. It's your ability to use published research. Just because something's published doesn't mean it, again, intuitively leads to a research project or intuitively helps you design your own work. It's the ability to apply research findings to real-world work settings. We all know that one of the greatest shortcomings of rehabilitation research is that research is frequently done in a setting in a university, and then what comes of it in the real-world clinical advocacy areas is somewhat lacking, and the ability to apply research, to do that knowledge translation is difficult. And it's also the ability to maintain the research cycle. Research isn't simply getting an idea, doing some sort of project, and publishing your findings. It's building on that one publication or that one stream of thought to the next and to the next to help our consumers, our constituents of people with disabilities. Beyond the faculty elements, there are institutional elements that are key to research capacity. These are the environmental resources to conduct research. Everything from having office space that's adequate for doing research, to having computers sufficient to run statistics, to having an office of sponsored programs to handle the grants and contracts elements of an application, to having an actual grants and contracts office that is able to programmatically set your project up and see it through to completion. It's also having internal accounting methods and fiscal affairs people to help you along as an investigator. It's something that requires a research culture. If you're teaching 4 classes a term, that's basically your 40-hour work week, if not more. A research culture means that you have the time, set aside in your career to be able to actually read about whatever's relevant to you as a scholar, to be able to develop your ideas and engage in a research process. It also means that the people around you have to have the exact same time and the exact same ability, because research doesn't spring from an individual. Research springs from a community of scholars, being able to talk about their research ideas, their research methods, and get something from a seedling up to a full-scale operation. Even if your colleagues don't conduct research in the same areas that you do, without that circle of constituents who engage in research, it's very difficult to do your own research projects. And finally, institutional supports, such as assistance in mentoring you, assistance in writing grants, helping you with the fundamentals of getting the non-science aspects of a grant together. You know, anywhere from 10 to 30% of any grant application is typically the institutional forms, the budget, the compliance, and all the other aspects of a grant application that have little to do with the actual science in terms of the thinking of it. And without the institutional support to be able to do that, the ability to conduct research is highly limited. Now, having said that, what we wanted to know is, what do people involved in disability and rehabilitation research settings in minority institutions and those serving minority populations, what do they have? What is the research capacity? Our overriding research question is, what do rehabilitation and disability research faculty need to increase research productivity in minority rehabilitation and disability research? It's a simple question, but it taps into a great many things.
Hi, I'm Carolyn Graham, and I'll be discussing a little bit about the research methods we used to conduct the survey for this study. We began our research study by using the Delphi method to determine what type of items we wanted to include on the survey. We interviewed faculty, professionals, and consumers of rehabilitation research. And Steve West, Kelly Gary, and I constructed those questions. From that, we sent it out to the advisory board, we sent it out to other project empowerment team members for their feedback. Then we uploaded it to a SurveyMonkey. It's an online survey process. The research assistants gathered names of rehabilitation and disability faculty across the country, sampling both historically Black, Hispanic serving institutions, and predominantly white institutions. We gathered names and emails from over 1,000 faculty across the country. 99 responded to our survey. That's a response rate of 5.2, which is quite small. This survey included questions concerning research capacity. There were 31 items having to do with that. There were 9 items having to do with cultural sensitivity and minority research. There were 2 questions about research skills. What research skills were needed? What would they like us to provide? And then there were 9 demographics.
Okay, so what did we find after we developed the survey? We went through the Delphi method, we developed a survey, we had our peers look at it, and then we implemented via SurveyMonkey. First, the demographics of our sample. Now, we're going to make some distinction here that our sample was not a junior faculty sample, but I believe you will find that they were a junior scholar faculty, and that's an important distinction. A lot of these folks were tenured associate professors at their respective institutions, but they were rather junior or novices to the research practice. Overall, the sample was middle-aged, average age of about 48 years old, approaching 50, with a standard deviation of about 10. We did have some true junior faculty in the 30 age range, but we also had some pretty senior faculty in the 50-year-old range. The sample was predominantly female, about 56% female. That's about right on for disability and rehabilitation research departments, which are typically quite female-oriented. The faculty were, for the majority, junior faculty. 51% were junior faculty, meaning they did not yet have tenure. And 80% of them were at public institutions. A little bit skewed toward public institutions, but for the most part, very much like the national average. The types of institutions that were represented were generally evenly split between small, medium, and large schools, with small being less than 5,000 students, medium-sized institutions between 5,000 and 15,000 students, and large over 15,000 students. Just about evenly distributed there. We had 18% HBCUs in our sample. We had 37% Hispanic-serving institution faculty members, and not quite 45% in historically predominantly white institutions. Key to our findings is understanding what the professional responsibilities of each faculty member was in their respective institutions. When we looked at the tripartite of what a faculty member typically does, teaching, research, and service, we did see some variations based on institution type. Again, the predominantly white university versus the historically black college or university versus the Hispanic serving institution. For historically black institutions, HBCUs, it was a nice even mix between research, teaching, and service, with teaching having a slightly but not overwhelmingly large percentage of time, just about 47%. Research having about 31%, a good percentage of time allocated to research, or at least a good percentage of effort being judged of the faculty members in the area of research. Hispanic serving institutions had a slightly higher percentage of time dedicated to research at about 37%, and predominantly white institutions at about 36%. When we looked at the actual faculty members by their ethnicity in terms of what they were expected to do, regardless of what type of institution they belonged to, we saw about the same thing. Research fell between 31 and about 37% based on ethnicity, with African Americans averaging about 32% of their time allocated to research, or at least 32% of their time being judged in their research productivity, 36% for Anglos or whites, and 37% for Hispanics. So regardless of type of institution or what the individual respondent racial or ethnic identity was, about a third, give or take, percent of their time was dedicated or evaluated by their research productivity. So what did these faculty members do, and what did they need? The areas that faculty members wanted guidance in, where they needed help, where they needed some supports in getting that research capacity up and going, were basically what you would think were the standards, and they were the standards across institution type. They wanted help in finding appropriate requests for proposals that fit their faculty interest. Now, we all know that there are hundreds of RFAs that come out from the federal government each year, and dozens that come out from foundations. These individuals either needed help in identifying things that fell into their topic area, or they needed time to actually go out and find that. We'll come back to some of these issues as we go into the findings. They needed help in finding funding for culturally oriented research. If they wanted to do research that impacted or was impacted by cultural aspects, be it race or ethnicity, they had a difficult time doing it, and they needed additional supports in doing that. They wanted to see courses being taught in cultural relevant, cultural competence areas with regard to research. It's not enough to have a cultural class, a class devoted to diversity, but a class specifically designed on how to conduct research on disability and research topics that are culturally relevant or tapping into cultural diversity issues. And they needed basic supports in grant writing. The support they needed for their research capacity from their institutions, in other words, the failings or the shortcomings of their each respective institutions in providing research capacity, was startup funding for new faculty. We all know that today it's very difficult to get a grant funded if you don't have pilot data or you don't have a track record of conducting research in the area. We get that opportunity in many cases from funding provided within the institution for its own faculty members. Many of our respondents reported that they were unable to get that type of funding because it simply was not available at their institution. They needed funding specifically for pilot studies on topics relevant to cultural identity, race, and ethnicity. In cases where such funding was available, it didn't specify cultural topics as being relevant for the funding mechanism, and so they were left out again. They also needed the general supports of institutions with regard to research development services. Most of our respondents had no specific research development resources available to them, like grant support, grant writing support, biostatistical support or statistical support, fiscal support, admin support, and so forth. With regard to cultural awareness and knowledge, most of our faculty are most of our respondents were culturally aware and sensitive to racial and ethnic nuances in research methodology. That's stuff they knew, and they understand the importance of institutional barriers when they conduct their research. So they know their topic area, and they know what types of things inhibit them from being able to engage in that type of research in their homes. What they needed was multicultural consultation and training to incorporate into their research going forward. Most of our respondents also indicated that they needed more dedicated time to conduct research. The participants in this study noted that their teaching loads inhibited their ability to engage in the research process. Again, most of our faculty respondents indicated about a third of their time was dedicated to research, or at least they were evaluated in terms of their overall productivity, in as much as that 30% of it should be research-oriented. But they still said that their teaching loads were such that they couldn't engage in research the way they wanted to, at least in extramural funded. We did see some group differences in our results. Research capacity element scores range from 0 to 4, with greater scores of 4, indicating that they had a greater capacity for each element. We asked them with regard to several key areas: environmental resources, the ability to maintain the research cycle, funding support, and institutional support. Elements were scored and summed to come up with a research capacity score of which range from 0, none, to 16, very good. We did see some discernible group differences with regard to research capacity. Males had an overall higher score of 9.0 compared to females at 7.7. It's notable that the best score was still 7 points below the optimal score, but a 1.3 point difference is notable and significant. Full professors had higher scores than both associate professors and assistant professors or instructors, obviously. But the difference between instructors, assistant professors, and associate professors were not significant. With regard to environmental resources, males had greater environmental resources and supports than their female colleagues, 2.3 compared to 1.9. Professors were higher than assistant professors or instructors, but associates were no different from either, full professors or assistant professors. With regard to the ability to maintain the research cycle, getting a research study up and funded, running through that study, and then building on it with additional research, faculty at institutions with 15,000 or more students reported higher scores than those faculty at institutions with 5,000 or fewer students. No difference was found for medium-sized institutions. With regard to funding support, full professors were better or reported higher scores than both associate professors and assistant professors or less. But notable here is that the highest score was only 2.5. That's still quite low. Predominantly white serving institutions were higher than HBCUs, or what we refer to here as HBIs, 1.8 versus 1.5, and no difference was found for Hispanic serving institutions. Again, these are terribly low scores, though, which indicates to us that there's a need for research capacity building across the board. And when Dr. Gary comes to speak, she'll follow up on that. Faculty at large institutions were also higher than those at small institutions. Again, those at the very largest seem to have more supports and more time than those at small institutions. With regard to institutional supports, those factors that might or might not be there to help you get a grant up and running. With regard to institutional support, males had higher scores than females. Caucasian faculty had higher scores than those from other races, and no differences were found for African American faculty members. Full professors were slightly higher than associate professors, but there was no difference with regard to assistant professors.
Hi, my name is Dr. Kelly Gary, and I'm going to finish with the discussion of the needs and the group differences, the needs that were expressed by the faculty members that we surveyed. With regards to the needs, we're going to kind of look at this from the perspective of a summit that we alluded to in our introduction. There was a rehabilitation medicine summit that was done back in 2005, where quite a few disability researchers were there, and they came up with recommendations and solutions to improve the research capacity for individuals that want to do research involved with rehabilitation medicine, physical medicine, rehabilitation, and disability research. So we're going to kind of look at their solutions and their recommendations and try to modify those to help the faculty members that we have surveyed, to present recommendations for the faculty members that we have surveyed. In summary, again, the needs related to the guidance that these faculty members would need to find RFPs and to find additional training related to their areas of interest. Also to identify funding that would help them, particularly pilot funding and startup funding. Of course, multicultural consultation and training, and also there were needs for decreasing their teaching load so that they can enhance their research productivity. Well, in relation to guidance and finding some pilot funding, there was a recommendation that was given by the Rehabilitation Summit about giving a message to the funding agencies to focus more on what they were focusing on, which was rehabilitation research. However, we can also look to these same funding agencies for more of the guidance that we need for this particular area of interest, as far as working with racial and ethnic minorities and doing more disability research and rehabilitation research. Some of the agencies that have actually made this a priority and have developed and implemented funding to help with this are the National Institute of Disability and Rehabilitation Research, which is a big agency that focuses on disability and rehabilitation research, hence its name. And then also the National Institutes of Health, particularly the National Institute of Minority Health and Health Disparities, NIMHD. Other agencies that have also had diversity as one of its core missions is Robert Wood Johnson Foundation and the Office of Minority Health. As we look at, or as we search for pilot funding, NIDRR, which is the National Institute of Disability and Rehabilitation Research, has actually offered some pilot funding that can help in this area. And pilot funding such as the Mary E. Switzer Award, which is geared towards not only newer researchers in the field, but then more distinguished researchers in the field as well. They have merit awards that would be for those that are less than 7 years of research experience. And then they have distinguished awards for those over 7 years of experience. This is a 1-year grant that would allow you to buy out your time to solely dedicate yourself to collecting pilot funding and doing pilot research so that you can work towards larger grants later on. The National Institute of Minority Health and Health Disparities, NIMHD, also has some funding that can be geared towards doing pilot research. They have training awards such as T grants, which you can apply for that could help with pilot funding. And then also they have K awards, which are a lot of times either mentored awards or independent awards without mentorship, where it would lead you more towards getting larger grants later on. Also, the Robert Wood Johnson Foundation has a lot of guidance, and their core mission is to work and to award more grants for individuals interested in racial and diversity research. And then the Office of Minority Health is another place where you can, and they have research programs that are available. They have a lot of guidance also on their websites, in particular information about proposal and grant funding and grant writing. Also, in relation to startup funding, one of the recommendations of the summit that I was referring to a while back, they talked about focusing on the infrastructure and building collaborative partnerships. We can use that as researchers that are interested in disability research and rehabilitation research for racial and ethnic minorities, and we can fine-tune that for our own needs. When we're looking at building intra-institutional partnerships to access institutional funding, that is something that we may be able to do. If there is not funding or people in your department that can help guide you with doing the type of research, your interest. Maybe building relationships within your university with other departments that have been doing more research funding or that have been doing much more research on a larger scale will help with giving you that information or giving you that startup funding that you need through that collaborative experience. Also, collaboration with stronger research institutions can be done so that you can access outside research resources. For example, the Virginia Commonwealth University offers a community engagement grant. It's a small grant for community engaged researchers so that they can use that and use it for pilot funding, and so that they can work towards bigger grants later on. There has been a partnership that's been created between Virginia Commonwealth University and a smaller minority serving institution. And that partnership, they use that partnership to get some pilot funding for their idea by partnering with Virginia Commonwealth University. So that might be another good way to access startup funding that you might not have been able to access because the institution has less resources. Another need that was expressed by the faculty members that we surveyed is multicultural research training. And a suggestion, a recommendation that was delivered by the Rehabilitation Medicine Summit was placing high priority on training new investigators. Well, there are quite a few agencies that do place priority on for training new investigators. One of those agencies is NIDR. NIDR actually has a advanced rehabilitation research training program for individuals that are interested in rehabilitation research. And actually, as an example, there has been some slight modification of those particular programs to focus on individuals interested particularly in minority research. So VCU, Department of Physical Medicine and Rehab, Division of Neuropsychology, has actually had a ARRT grant for many years, but not necessarily focused on individuals that were interested in minority research. However, they were able to use some of that money when they found individuals that were interested and design a particular program specifically for those new researchers that are interested in training to do rehabilitation research in the area that that ARRT program focused on. Also, NIH has some training opportunities for new researchers as well. There are quite a few research supplements that are for underrepresented minorities that will allow new investigators, actually from the undergraduate level all the way to the postdoctoral level, to become involved with individuals that have well-established NIH grants, particularly R01s, and it gives them funding to help with those grants. So they are learning the nuances of NIH research. And then also they can morph any of the information that they have gotten off of that grant. They can morph it and they can use it to come up with research ideas for research, for rehabilitation research, and for racial and ethnic minorities. Another program that places a high priority on training new investigators is the Kellogg Foundation. The WK Kellogg Health Foundation has a program for health scholars. It is a postdoc program, and it's divided into a multidisciplinary track and divided into a community track. And in that multidisciplinary track, they have individuals from some of the top universities, such as Harvard and University of California, Berkeley, that you can connect with and train with for if you're interested in all types of research, particularly rehabilitation research. And then also with the community track, they have other great institutions like the University of North Carolina, Chapel Hill, and their focus with the community track is to teach individuals about community-based participatory research, which is another type of research that is specifically tailored to enhance the nuances of rehabilitation research for individuals of racial and ethnic minority status. Also, the Ford Foundation places a great focus on increasing the racial and ethnic diversity of professors in the field, in all types of fields. So that's another institution where you can look towards to look for training opportunities for racial and ethnic minority researchers. In summary, our faculty members that were surveyed have expressed a lot of needs. And with some of this that we have suggested, we can address some of those needs. Also, they have also talked about decreasing their teaching load. Now, we all would like to decrease our teaching load, and that's quite difficult. But with the more research and more funding that you receive, the better you can be able to negotiate with your departments and with your chairs and with your deans about decreasing your teaching load so that you can dedicate more of your time to doing rehabilitation research. This is the end of our presentation today. We would like to thank you for listening to us, and we look forward to anybody's questions on our web board.